Hello, good afternoon to all. Just a short introduction about myself. I'm Dr. Gooi. You can call me Cindy. I'm an orthopedic surgeon with experience of more than 15 years in orthopedic surgery. And for the last 6 years, I took up the challenge in treating the growing bones, meaning the pediatric and the adolescents. So what I do all fractures, deformity correction, reconstruction surgery for limb length discrepancy, adolescent spots, and also surgery for cerebral palsy. So today, I just want to share some experience of treating the pediatric bones and also the fractures. How is treating an children bones different from an adult's bone? Beside the size, it is a smaller and shorter. There is still a lot of difference, mainly the anatomy, the blood supply. Hence, treating a pediatric bone or a growing bone is not exactly same like treating an adult bones. Just for example, because of the smaller size, the implant that we use for an adult fracture is not suitable for treating a pediatric fracture. There are few features in the growing bones that difference from the adult. First, about the elasticity. Because in a growing bone or the children bone, it's more elastic. It tends to bend, but not completely fracture. It can undergo a plastic deformity or some incomplete fractures called as ring stick fracture or a torus fracture. Because of these features, sometimes recognizing these type of fractures in an individual of not so familiar with children may be of challenge. This is an example of an incomplete fracture in children after they fall in the playground with an outstretched hand where they have an incomplete fracture over the forearm. It's a very common scene, and if these fractures happen, the treatment is fairly simple. By putting on a cast for about 3 weeks, and after off the cast, the kid can play again like any other child without much complication. However, fractures around the elbow is a little bit more complicated because of the anatomy itself. It is thinner and near to the joint. And if this type of fracture does not treat properly, the child may end up with deformity. What are the deformities in? Example, they may have the elbow bent inward or bent outward. However, if this does happen, not to worry, we still have the opportunity to make it straight again. So this is just to show about an implant specially designed for children because of their smaller size that you need some nails to stabilize the displaced fracture. We don't use this type of implant in adults, but only in children. Next, in children bone, they are not fully calcified, meaning it's not fully formed bone. Um, some of the bones are still in cartilage form, which cannot be seen in the X-ray. And an example, the X-ray over the left side, where there is a dislocated hip joint, can be easily identified. However, the X-ray over the right side, because the femoral head is not well formed and not seen in the X-ray, it can be missed. So sometimes an individual who are not familiar with children may easily miss a children hip dislocation. Another example, the children has a special features with the growth plate and it looks like a fracture in the X-ray. Example, in the X-ray of the right side, there is a line at the elbow region and sometimes people may confuse that there is a fracture because the patient had a fall and refused to move the elbow. Actually, the kid has only a pull elbow, which is a subluxation of the radial head, but it's not a fracture. In that scenario, sometimes the kid was put on a cast unnecessarily. On the right side, where it is an X-ray of an adult, you can see no line at all because in adults there is no growth plate anymore. Another example where children after sports complaining of pain around the ankle joint. So sometimes people will think that the growth plate is a fracture again, but it is a common condition called as traction apophysitis, just an inflammation around the growing bone of a children. So next we come to something very important, which is the growth plates. These growth plates, or we call as the factory for a growing bone, only available in a kids. For female or a girl, this growth plate will fuse at the age of about 16 years old, and for boy, it is around 18 years old. So what is it so important about this growth plate? The growth plate or the factory responsible for the development of a growing bone, which make it a longer bone and a bigger bone. Hence, any injury to this will retard the growth of the bone, meaning it can be shorter or it can be deformed or crooked and causing a limb length discrepancy. So there are many types of growth plate injury. You can have a mild type that doesn't affect the growth much, or you can have a severe condition where the growth was totally retarded. So as we have a lot of road traffic accident, nowadays children may involve in the road traffic accident too. Look at the x-ray. It is a fracture around the knee region where there is a severe displacement from the growth plate. Frankly speaking, this type of injury, no matter how the treatment, the child may still end up with deformity or with a limb length discrepancy. Example of a kid with an injury around the knee region and cause leading to a limb length discrepancy and also an angular deformity. Not too much to worry because all these can be handled and can make it straight again. The patient undergone an immediate straightening of the bone, and if you look at the, the side of the thigh, there is an apparatus and there is also a way to lengthen the bone to make it equal again. Another example, also following a road traffic accident, where you can see a multiple scars treated well initially, but as this boy grow, the bone grow outwardly, meaning it's not straight anymore. So he needs to go through surgery to straighten the bone, and he can grow like any other boy again. The next features of a children bone is softer, and hence because of that it is stretchable and moldable. So if you notice any deformity when your kid is young, treat early and there is a chance of um, becoming completely normal again. A common scenario is the club foot that we commonly see in a newborn baby, where the foot position is not right. However, if you go through a serial casting, weekly molding, and put in a proper cast, this kid can run as any other kid as he grow up, and the problem can be treated as soon as possible. Next, another condition is newborn baby where you notice there is a slight tilting of the head. Again, the same thing because their structures are still soft. So treat early where got undergone a physiotherapy and they can have a straight head again. Finally, I just want to emphasize something. It's on a non-accidental injury. This also called as a child abuse injury. So sometimes children come with fractures, however, they can't express themselves. They may be not good in talking yet. There are some telltale signs. Example, children with fractures, oblique type of fractures due to a twisting injury in children less than 3 years old, or lower limb fractures in children that not able to walk yet. And when the history is not consistent, then always the non-accidental injury must be in the mind, because the important thing of um, have the suspicions of non-accidental injury is to prevent a next worrying injury again. So there are telltale signs that can um, point to the non-accidental injury. So it's important to be examined properly. So now maybe we can look at a few questions that has already put online to me. First is on how do I know if my child has a broken bone or a fracture after a fall? Well, the child, if had a fracture over the lower limb, he will refuse to walk. And of course, he will cry. And when looking or examining the limb, you will see a swelling, deformity, and also tenderness, meaning pain. So what you should do, send the children to the nearest hospital to get properly examined and to get an x-ray done. Next, when are bone fractures cause for concern? Well, simple forearm fractures, undisplaced incomplete fractures, usually healed without much complication. But however, if fractures around the knee region, hip region, elbow region, ankle region, which means fractures around the joint, may cause problem. Why? Because our growth plate, which is the factory of the bone growth, usually locate near the joint. Also, if any joint injury, it may cause stiffness and also fusion of the joint because of the cartilage injury. And as we mentioned earlier, growth plate injury may end up with limb length discrepancy and also varus valgus, meaning the bone may be deformed. Okay, another question. Will broken bones in children affect their future growth? Yes, of course, if it affects the growth plate. And of course not if it's just a simple incomplete fracture. Depends on the type of fracture. Next, what is the first thing I should do if my child breaks a bone or dislocated a joint? Minimum movement of the involved limb. Why? Because if there is a fracture, the more you move, the more bleeding, and sometimes there may be a nearby blood vessels or nerves that the end of the sharp broken bone may injure too. So if you can splint the involved limb, then splint it. If not, minimum movement and get your kid to see an orthopedic surgeon directly, and an x-ray will confirm and the child will be treated properly. So how long does it take for a fracture to heal? It all depends on the location of the fracture, whether it is upper limb or it is lower limb. Generally, in upper limb, the bone for a kid heals in about 3 weeks' time, but for the lower limb, it heals about 6 weeks' time. What is growing pain? This question is very common and always children come with growing pain. It is sometimes a very benign condition where they have pain around the anterior thigh or over the posterior cuff. So this usually happen around the age of 7 to 8 years old, and after they have a whole day of activities running around, and at the evening time, night time, they start complaining of aches, and it happens both sides. Most of the time, both sides, not only one side. And till the next morning, they will wake up without pain and continue their normal activities running around again. That is the growing pain. However, sometimes you need to be careful if it the kid locate it on a specific joint, or even wake up in the morning, the kid still have pain and unable to wait there, or affected their lifestyle, then you should always seek advice from an orthopedic surgeon. Next, If my kid has some minor bone deformity, will it heal on its own, or should I bring him to see a pediatric orthopedist? Bone deformity, there are many types. So it depends. Some may heal by itself, but some it will become worsen or get worse as they grow. So if you have any concern, just bring your kids over and we can do a proper checkup for the patient. When should babies start walking? Should I be worried if my child is still not walking compared to his cousin of the same age? Usually children start to walk about 11 months old and they can walk even better by the age of 14, 15 months old. But if at the age of 18 months and your child is still not able to walk independently, then you should always seek a doctor advice, either a pediatrician or orthopedic surgeon. It's fine, but he need to be screened because sometimes it may related to their brain, their muscle and skeletal development. So next question. I recently noticed some shoulder imbalance and pelvic tilt in my daughter. What are the possible causes? Okay, the first come to your mind will be always my daughter having a scoliosis, and that is quite common. And the other thing is there any limb length discrepancy? So your kid need to be checked properly and x-ray need to be done. Sometimes habitual, yes, but we need to examine and rule out and the underlying possibility of scoliosis or any limb length discrepancies first. Next, my child suddenly starts limping few days ago. What should I do? Limping is not normal. The limping can be either a painful limp or non-painful limp. You must also check whether your kid had any trauma before or the limp associated with any fever, irritability, and if the limp is like sudden and not goes off, your kid is unable to wait there, what should you do? You definitely need to seek treatment and you need to be examined by a doctor and a proper treatment should be carried out. My son has cerebral palsy. He used to walk with the help of a roller walker, but lately only wants to sit on a wheelchair. What should I do? Well, for cerebral palsy patients, as they grow, their motor development changed. They may have difficulty in walking as they grow bigger, heavier. Sometimes it's because of the tightness of the tendons, example the hamstrings, the Achilles tendon, and causing difficulty and need to use more energy to walk, and hence the kid prefer to sit on a wheelchair. But it's very important to rule out something very crucial, which is the hip dislocation. One telltale sign that you can see whether the hip is subluxated or dislocated is by looking at the knee level, whether one is higher or one is shorter, or when you are changing the diapers of your son, um, one side is a little difficult to open up compared to before. So that strike your mind. You need an x-ray to confirm the hip is not subluxated or dislocated, because if anything to be done earlier is much better for your kid and he may walk back again. So next, is my child toe walking normal or is it a sign of trouble? Toe walking is not normal. Okay, the cause, multiple cause, it can be due to a tight Achilles tendon, it can due to a poor motor development, muscle weakness, or sometimes it can associated with cerebral palsy children, which was not diagnosed before. So what should you do? Need to be checked and examined and find out the root cause. My child walks bow-legged, and when should I be concerned? So it all depends on the age that presented with a bow-leg, whether it is a very young age or age more than 2 years old, like for my guideline. Because bow leg at a younger age, less than 2 years old, can be physiological and they can improve with time. However, if it is unilateral, meaning involve only one side and is worsened with time, then some problem with the growth plate may be there. And another possibility of a bow leg sometimes is linked to some metabolic disease like a rickets or a soft bone disease. So next, how do I know if my child has a flat feet and how is it corrected? Um, to see whether your child has a flat feet, well, you can look at the footprint, whether it is like a flat feet footprint or you look from the behind, the hind foot, it's bent outwardly. There are many types of flat feet, whether it is a flexible one, whether it is a rigid one, correctable or uncorrectable. So it depends also on the age of the presentation. So some may just due to the laxity, but some severe cases, they may need a correction to make their gait better. So I'm not sure if there's any other questions, but thank you for the attention, thank you for the support, and I hope that my sharing is enjoyable to you all. Thank you so much.